Now, after completing about the intercostal arteries, both anterior as well as posterior intercostal arteries, now in some of the exams they are even asking about the branches of internal thoracic artery also, guys. So, let us see the branches simultaneously, and this will be done completely, guys. So, what will be the branches of internal thoracic artery? Good thing here is that you already know few branches, guys. Number one, you already know that internal thoracic artery will give rise to anterior intercostal arteries, and that too upper 6. Okay, you already know these branches, and you also know the two terminal branches. Those are also branches of internal thoracic artery only. So, one will be the superior epigastric artery, which we have said that it is going to continue down into rectus sheath, and one more will be the musculophrenic artery. Musculophrenic artery. So, these two are actually the terminal branches. It is going to terminate. It is going to end by dividing into these two branches, terminal branches, and this thing also you already know there. Now, just add a few more branches there. Number 4, mediastinal branches, and I think you don't have to do a lot of hard work to remember this one. Just adjacent to the sternum, internal thoracic artery, in the mediastinum, mediastinal branches, but they'll be supplying to what? The mediastinal branches are the one which will be supplying to the remains of thymus gland. Thymus, okay, it will be supplying. Next, number 5, you also have like one more branch which is pericardiophrenik branch. Pericardiophrenik branch. I think I don't even have to teach you here. The name itself explains everything. Pericardium covering the heart, and then phrenic, diaphragm and all. And number 6, in females, guys. In females, what is happening? The internal thoracic artery will also give certain perforating branches here. And these perforating branches are the one which will be actually perforating through the fascia and will be supplying to the mammary gland. That is the reason why internal thoracic artery is also said to be the internal mammary artery. Already I said to you about this one. Okay. So, that is all about the branches of internal thoracic artery, and that completes your entire topic of intercostal arteries, guys. So, all the anterior intercostal arteries, the posterior intercostal arteries, and then there are certain questions asked based on the branches of internal thoracic artery also, even that also has been completed in the same sequence. Perfect. I hope you all still remember my planning. Thoracic wall, in the thoracic wall, intercostal space, inside the intercostal space, intercostal artery, vein and nerve. And out of these 3 we have now completed with the intercostal artery. Now let us move towards the intercostal vein now. Now look at this complicated diagram here, guys. That is about your intercostal veins. Now, before moving towards this topic and making the things very simple, let me tell you one thing here. This topic is extremely important, and I want you all to be like really alert now, more alert now. Why? Because we are going to come across azygous vein, hemiazygous vein, accessory hemiazygous vein. Everything I am going to teach you here. First thing. And second thing that you have to remember, the good news here is that just now we have learned about the intercostal arteries, and I told you that there will be like 2 types of intercostal artery. There will be anterior intercostal artery and then there will be posterior intercostal artery. There will be 2 of them, and along with that or accompanying with that you should also have the intercostal veins also. Makes sense? So, there will be even anterior intercostal vein and there will be even the posterior intercostal vein will also be there. Is it okay? So, along with the arteries you also have the corresponding veins, guys. But the good news for you here is that you don't have to learn about the anterior intercostal veins. Nah. Why? Because whatever arteries that you have learned going on giving the branches, in the same manner just come ulta. I mean to say in a retrograde manner, the same veins will be there and they are going to just drain the blood. Let us just give it a try. For example, the 7th, 8th and 9th, 7th, 8th and 9th anterior intercostal vein, and that anterior intercostal veins will drain into musculophrenic vein, and that musculophrenic vein is going to combine with superior epigastric vein, and together it is going to form your internal thoracic vein, blah 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 blah. Understanding? So, it is absolutely the same like an artery only. So, no need to worry about that one, and not even like many questions are asked about that. Now, the only thing that you have to worry about is posterior, guys. the posterior intercostal vein. So, in veins, the good thing, you don't have to worry about the anterior, you just have to learn about the posterior intercostal veins. And again, the same thing, they will be on the right side as well as on the left side. And what we have to learn here, we got to learn like which vein will go and drain where. It's a tributary of which vein we need to learn. It is going to go and drain where. Okay, and there are a lot of questions asked based on this one, and recently have asked the question in the AIMS exam and all. So, it's like very hot favorite topic of the examiners. So, let's start with our diagram here, guys. So, basically what are we learning here? We are actually going to learn about the posterior intercostal vein, not the anterior, only the posterior intercostal vein. Now, to learn about this posterior intercostal vein, first of all, let us make the platform ready. I mean to say, there is a little bit of background story here. How is our superior vena cava formed, guys? Superior vena cava will be formed by, there will be a right brachiocephalic vein here, and then we have got the left brachiocephalic vein. And these two will join together to form your superior vena cava. So, superior vena cava is formed by the right brachiocephalic vein and the left brachiocephalic vein. Make sure the left one will be more oblique, right brachiocephalic and the left brachiocephalic. Both of them will combine to form superior vena cava. Then below here somewhere you will be actually having your inferior vena cava also. I will tell you the importance of that one, like why I am drawing the diagram. Superior vena cava, inferior vena cava, both of them are going to drain the blood into right atrium of the heart. So, in the middle there will be heart, and we do not have to draw it right now, that is not our topic right now. Till here it is okay, every student will be knowing this one, guys. Now starts the real concept, azygous vein. Now, before moving ahead and drawing the diagram of azygous vein, I want to go it like more conceptually, guys. As a medical student, we are able to understand why the name is given as superior vena cava. It is going to collect the blood from upper half of the body. And why the name is given as inferior vena cava? It is the one collecting the blood from lower half of the body. Perfectly fine. But why is the name given as azygous vein? As a first year MBBS student, I am like more curious to know what is the meaning of azygous. So, remember, azygous means unpaired, single. There is only one azygous vein. Azygous means unpaired. There is only one single azygous vein. And if it is only unpaired, single one, so is it towards the right side or towards the left side of the body? So, remember, there will be only one single azygous vein, and that is towards the right. Ascending up, and finally it is going to drain into the superior vena cava. So, azygous vein will ascend up, and then there will be arch of azygous, and that is going to drain into superior vena cava only. Perfect. So, let me just write down here as azygous vein. Then, sir, the next question in our mind is, if there is only a single azygous vein, the name itself is telling you, the meaning of that is unpaired, single. If there is only single azygous vein, that too towards the right, then what about the left side? From the left side, the blood will be drained by what only? Yes, you do have hemiazygous vein on the left side. So, there will be like accessory hemiazygous vein, and then from the left it is crossing and coming towards right. And then there will be hemiazygous vein, and that is also crossing and coming towards right. And from my diagram, you can see it crystal clearly, both of them are going to drain into azygous only. So, let us write down the name here. This is accessory hemiazygous vein, okay, crossing from the left towards the right and draining into azygous vein. And yes, there is a possibility of one more question here. It is crossing at which level? Accessory hemiazygous vein will be crossing at the level of T7. And just below that, you will be able to find the hemiazygous vein. Hemiazygous vein, and that is crossing right at the level of T8. It is crossing at the level of T8, guys. It makes sense. So, azygous, learn with the meaning, start from the scratch. Azygous means unpaired, single, and it is only towards the right side. So, what do you have on the left side? On the left side, yes, hemiazygous and accessory hemiazygous. Now, this is all done. Perfect. Now, what is our actual topic here? Our topic is posterior intercostal veins. Intercostal vein, the posterior one. Now, they are going to drain where? Observe here. First, let us see towards the right side. I mean to say, what is the complete name of the vein now? The complete name of the vein will be right posterior intercostal vein. First, let us see towards the right side. And on the right side, remember the very first right posterior intercostal vein, drains the blood into right brachiocephalic vein. Be alert from now onwards, this is important now. Right side, the first vein is going to drain into the right brachiocephalic vein. And then the second and the third and the fourth, these three veins combining together, and they are going to form a common vein, and that common vein is referred to as your superior intercostal vein. Superior intercostal vein, and of course it is towards the right side, therefore the complete name will be right superior intercostal vein. I repeat again, right superior intercostal vein. And we can see very clearly from my diagram here, yes, it is going to drain the blood into the azygous vein only. It is draining the blood into azygous vein, that is important. And after that, don't worry about anything else guys, no need to even memorize the numbers and all. Remaining all, I mean to say the 5 and the 6, the 7, 8, 9, 10, 11, all of them will be draining into azygous. So what are you understanding from here? You are understanding that you should be like really careful only with the first, second, third and the fourth one. Those are the numbers where you have to concentrate. Remaining all of them will be draining into azygous. That completes the right side in a crystal clear manner. Now what is happening towards the left side, sir? Towards the left side, left posterior intercostal vein. The left posterior intercostal vein. Let us see. The first one exactly the same. It is going to drain into the left brachiocephalic vein. No confusion at all. On the left side, the first one is going to drain into left brachiocephalic vein. Now what about the second and the third and the fourth? Again the same thing. These three will combine together. Okay, they are going to combine together to form superior intercostal vein, left side wala, left superior intercostal vein. And almost every examiner is interested about that one guys. It has been recently asked in the AIMS exam, where will it drain now? Now why are the examiners very much in love with this point here? Why? Because on the right side you can see it is going and draining into azygous, but whereas on the left side it is not going to drain into azygous. Why? Why? Because you don't have azygous on the left side. In the very beginning I told you it is unpaired. Understanding? So therefore what is happening towards the left side? Toward the left side, left superior intercostal vein, left superior intercostal vein will drain into the left brachiocephalic vein. Extremely important. Okay, let me highlight this one here. Left superior intercostal vein will drain into left brachiocephalic vein. It can't drain into azygous, there is no azygous on the left side there. And after that, the remaining veins guys, the 5, 6 and all those things, you don't have to remember the numbers there. The remaining veins, few of them are going to drain into accessory hemiazygous and few of them are going to drain into the hemiazygous one. And you don't have to waste your time in learning those numbers, they will never ask you that one. Is it okay? So that's about this complicated diagram here in your anatomy atlas, and that has been made easy here guys. So in this diagram, the azygous, hemiazygous and all those things, the posterior intercostal veins is made in a crystal clear manner in this manner. Question number 1. Hemiazygous vein will drain into azygous vein. True or false? Absolutely true. Accessory hemiazygous vein will drain into azygous vein. Absolutely true. And even the right superior intercostal vein will also drain into azygous vein. Even that is also absolutely true guys. So hemiazygous, accessory hemiazygous and a right superior intercostal vein, all of them are draining into azygous except one, except the left superior intercostal vein will drain into left brachiocephalic vein. And already this question has been asked, like all of the following veins will drain into azygous except one. Take care about that, and I think you will never make a mistake from now on. Now once you have completed this entire thing, let us see like how is the azygous vein formed. Whenever you are learning about any vein, you have to always learn the formation of the vein. Just now we have seen like superior vena cava. Superior vena cava is formed by a right and left brachiocephalic. So similarly you have to learn the formation. Now how is this azygous vein formed? Azygous vein is actually formed by 3 veins here sir. Number 1, there will be a vein coming from here, and you yourself can apply common sense and tell the name of that vein. After completing all the intercostal spaces, the last one, the last rib will be the 12th rib, and below the 12th rib you will be able to find that vein, and that vein has to be the subcostal vein. The name of that is subcostal. It is not intercostal, it is below the 12th rib. So if it is below the rib there, therefore subcostal. Okay. Then there is one vein which is coming from the abdominal region ascending up. And which region is this one, guys, in the abdomen? That is lumbar region. So therefore, number 2, this one here will be the ascending lumbar ascending vein, lumbar ascending vein. And the third vein which is important here, for which actually I am teaching you this one here, it is the one which is connecting the inferior vena cava with the azygous vein here, and this here will be the lumbar azygous vein. That is the one connecting that with the inferior vena cava with the azygous vein. So these three veins together, they are going to combine and form the azygous vein, ascending up from the abdomen, crossing the diaphragm, then entering into the thorax region, guys. Perfect. So therefore, let us write down the formation of azygous vein. Formation of azygous vein here, sir. Azygous vein is actually formed by three veins. I will be using the same numbers there. Number 1, a right subcostal vein. Right subcostal vein. Number 2, there will be a right ascending lumbar vein or lumbar ascending vein. Lumbar ascending vein. And then the last and final one, number 3, which is the one which is connecting that azygous vein with the inferior vena cava. So that one will be the right lumbar azygous vein. Lumbar azygous vein. So these three veins are the one which are combining together and they are going to form your azygous vein. And guys, this completes here the entire topic of intercostal vein. So basically, the good news here, the good thing here, we don't have to learn about the anterior intercostal vein. The only thing that we have to learn is about the posterior intercostal vein. And you just got to remember which vein will be draining, or it is a tributary of which particular vein there, guys. And to make it like more concise, to narrow down, you just have to concentrate on the first, second, third and the fourth posterior intercostal vein on the right side as well as the left side. The entire topic is made crystal clear here. That's all. That completes about intercostal vein. And now let's go to the last thing, intercostal nerve, guys. Now guys, moving towards the last and final thing, that is intercostal nerve. So we have already completed the intercostal artery in detail, intercostal vein along with that azygous system in detail. Now the last and final thing that we are going to see right now is intercostal nerve here. So there is a small concept to learn here about the intercostal nerve. See, we have got like T1 to T12, right from T1 to T12, all are your intercostal nerves over there. Now the only one important point that you have to learn here is which one will be the typical intercostal nerve. Remember, the typical intercostal nerve will be your T3, T4, T5 and T6. These will be the typical intercostal nerves. Now let me make you understand why these are known as the typical intercostal nerve. What is the meaning of typical intercostal nerve? Typical means it should supplies only and only to intercostal space. That's all, nothing else. That's important. Typical intercostal nerve means it should supply only and only to the intercostal space, nothing else. Okay. Now sir, then why is T1, T2 and the remaining nerves, why they are not typical? Let us try to understand here. Again the same thing, guys, recall our upper limb topic now. In the upper limb topic, the very first thing that we have learned, brachial plexus. What is the origin of the brachial plexus? C5 to T1, and therefore T1 is the one which will be supplying to first intercostal space. Not only the first intercostal space, it is also contributing to brachial plexus. If it is contributing to brachial plexus, can I call it as typical? No. Typical I cannot call it as. So why is this T1 not a typical one? Why? Because it is going to contribute to brachial plexus also. Okay, then so why not T2? Why is T2 not a typical intercostal nerve? The T2 is supplying to second intercostal space here. Along with that, it is also supplying to the skin on the medial side of the arm. So that is the reason why the T2 is also referred to as intercostal space, intercosto. Arm is also known as the brachium, intercostobrachial artery. So that is also not typical. Typical means it should supply to only and only intercostal space. Then what about the remaining nerves, sir? There is your T7, then the T8, T9, T10 and T11. All these nerves are not only supplying to the intercostal space over here in the thorax region, they will also continue down as a content of your rectus sheath in the anterior abdominal wall. So therefore, they are going to continue down into the anterior abdominal wall. anterior abdominal wall as a content of rectus sheath. So basically they are like thoraco-abdominal. They are supplying to the thorax also, intercostal space also, as well as the abdomen, the anterior wall. And the last and final one, T12. Why is T12 not typical one, sir? Again the same thing, that will also continue down and supply the abdominal wall, and it is known as a subcostal nerve, T12. Below the rib, that is why it is subcostal nerve, and that is also continuing down as a content of rectus sheath, guys. So I hope you are able to understand very clearly which one are the typical intercostal nerves, that is your T3 to T6, T3, T4, T5 and T6, and typical means it should supply only to the intercostal space, nothing else. Whereas the remaining nerve, they are supplying to something or the other, that is why they are not typical. Crystal clear concept. Now apart from this, I would like to tell you about one more concept here regarding the intercostal nerve. Let us draw a diagram, that too in a transverse section, and finish off this topic. So this is the last and final thing. Now for example, if this one here will be the vertebra, thoracic vertebra in the transverse section, and anteriorly here this one will be your sternum, of course in transverse section. Then what about the muscles now? There will be a external intercostal muscle, and this external intercostal muscle, when it will be coming near to the sternum here, anteriorly, here there will be a membrane. Here you will be actually having a membrane. It is not like a continuously muscle connecting to the sternum. I said you that in the very beginning also. I am going to go in more depth right now. So what is the name of this muscle, guys? This is nothing but your external intercostal muscle. An external intercostal muscle, anteriorly there is a membrane here. Now what is the name of this membrane? This membrane is referred to as external, or we can call it as anterior intercostal membrane. So external intercostal muscle has got external, or it is also known as the anterior intercostal membrane. Now what about the internal intercostal muscle? Internal intercostal muscle will continue like this here. It's like one single muscle going here. But behind here, it will be actually having a membrane. Now again the same thing here. What is the name of this muscle? This muscle is actually your internal intercostal muscle, and that muscle has got a membrane behind, and this membrane here will be referred to as internal, or else the posterior intercostal membrane. Hope the names are very clear. I am not confusing you. That is the reason why I am telling you a little bit slowly here. External intercostal muscle, let me just do it with the same color here. External intercostal muscle has got a membrane, that is external intercostal membrane, also referred to as anterior. Whereas internal intercostal muscle will have a membrane behind. That is the reason why it is posterior, or we can also call it as internal intercostal membrane. Innermost muscle, we have learned that in detail, innermost intercostal muscle is not at all a single muscle. There will be one here which is subcostalis, and there will be one here that will be sternocostalis, and in the middle you will be actually having the intercostalis intimi. I think we do not have to write those names again and again. Now where do you exactly have that neurovascular bundle? The neurovascular bundle is present between I and IM. So I is internal and IM is actually the innermost one. Internal and innermost, between them you are actually having the neurovascular bundle, artery, vein and the nerve, and out of that, my dear friends, intercostal nerve. Let us see right now. So imagine this is your intercostal nerve here, moving like this here. That is your intercostal nerve between the internal and innermost intercostal muscle. Crystal clear? And that is actually giving a branch here. This one is referred to as the lateral cutaneous branch, giving laterally, and this one here will be the ventral or anterior cutaneous branch. That is the anterior cutaneous branch. Now what is the question that they are asking in your exam says, the lateral cutaneous branch is going to pierce through which muscles or which membranes? So in the exams they are asking you that lateral cutaneous branch is going to cross through or pierce through which muscles or which membrane, and in our diagram it is crystal clear. The lateral cutaneous branch is piercing through what, sir? It pierces, yes, the two muscles over there, and one will be the external intercostal muscle and another one will be the internal intercostal muscle. Perfect, no confusion about that. Lateral cutaneous branch. And now welcome to the last and final thing here guys, the anterior cutaneous branch. The anterior cutaneous branch. Now please look at the diagram and try to answer yourself guys. Anterior cutaneous branch is the one which is crossing what, or it is piercing what? The anterior cutaneous branch pierces, yes, number one, you are able to see this muscle here. Which muscle is that one? That one will be the internal intercostal muscle, but it is not piercing the muscle, external one, which is actually piercing the membrane. That's important. That was actually asked in the exam. So it is actually piercing the external intercostal membrane, not the muscle, membrane. That is the one where you have to be very, very careful about. Okay. So lateral cutaneous branch is just going to pierce through the two muscles there, external intercostal muscle and intercostal muscle, whereas the anterior cutaneous branch is going to pierce through internal intercostal muscle but external intercostal membrane. I hope it is crystal clear concept here. And by this, we end the very first segment or the very first part of your thorax topic here guys. According to our planning, first we have to complete the thoracic wall. And I started in the very beginning from the scratch, and then we have gone in like in depth and in depth. Thoracic wall, anteriorly sternum, posteriorly thoracic vertebrae and laterally ribs. In between the ribs, intercostal space. Inside the intercostal space, intercostal artery, intercostal vein and the intercostal nerves in detail. Now after completing this entire thoracic wall, yes, according to our planning, we are going to enter inside. We are going to learn about two important organs. One is your heart and another is your lungs, and that will be done in the subsequent videos guys. Thank you. Take care. Done.